Thank you, Chrissy. Good afternoon, everyone. Dr. Strang will give us an update on COVID-19 in Nova Scotia today.
Thank you, Premier. Today we're announcing 32 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 549. There are currently 9 individuals in hospital, 4 of them remain in the ICU. 137 people now have recovered and considered to be their COVID-19 infection resolved. We now have 17,419 Nova Scotians who have been tested but with negative results. So as I've said in previous briefings, it's a good story as far as I'm concerned. We were testing lots of people. The vast majority of people are testing negative. And we have the appropriate steps in place to deal with people who test positive. And then again, thank you to the lab. Yesterday they tested again over 800, or they tested 885 tests, and so we remain one of the leading provinces in terms of our ability to have a high throughput of testing for our citizens. I know I've been asked yesterday about my decision to allow the parking lot Easter service. I wanted to address that again today because I know that there continues to be lots of discussion and criticism about my decision on social media. I made, as I said yesterday, I made this decision when a group, through their local councillor, brought forward their request with a clear rationale, as well as clear steps that were going to protect their safety while they held their parking lot service. So I approved that. I gave them an exception to my order under the Health Protection Act. I know that not everybody agrees with this decision, and I do understand that making exceptions can create confusion. A lot of faith communities are doing virtual worship, but I'm also cognizant that this may not always be possible, especially in rural areas where access to internet may be more challenging. However, we all need to be creative as we deal with COVID-19 in our communities and our homes, including practicing our faith, and many people are finding innovative ways to do that. So we're going to ask churches and other faith groups to continue to do that, and going forward, drive-in church services will no longer be allowed. The message we had yesterday that from the modeling, that is, we are at a critical point, or we remain at a critical point as in our response to COVID-19, and there are severe and serious implications from COVID-19. So it's extremely important that we continue to stick with our strategy of all of Nova Scotians sticking with the strong public health measures, staying home, gathering in groups of 5 or less, only when necessary, and only going out of your community for essential shopping or those who are still working. The more we do this, the less will be the impact from COVID-19, and the sooner we can return to normal. So I think it's really important that we stay focused on that, on what's necessary to get through this with the least impact and as soon as we can. I just want to talk about something briefly that struck me, and it came my way yesterday. From nationally from around people who are blind or visually impaired. They've raised the issue about that for them, we need to be cognizant, and asking the general public to be more aware that even though generally we're asking people to practice social distancing and be careful when you're out about in public, that while many people who are blind or visually impaired are very independent, but there may be circumstances where they actually need help from somebody that may require somebody breaking that rule around social distancing. So I ask people to just be cognizant of that if there is somebody who's visually impaired who looks like they need help, please offer your help. even if that does mean you have to break that social distancing, that's okay on those circumstances. Doing it in a way that through respecting hand washing, minimal touching each other, even trying to avoid getting face to face. But if somebody needs a hand on their elbow or just a voice to help them, please offer that. And this is not just for the visually impaired or the blind community. We have to understand there are many people in our communities with a range of disabilities that have unique challenges when it comes to dealing with all the rules we have put in place. So it's especially important that we think about, and in the government we are doing this. We have a special focus on people with disabilities. I would ask as I've asked people to do a lot around being caring, building community, that we take a particular focus as we're doing that on those because of a range of whether it's physical or intellectual disabilities may need extra supports and acknowledgement of the challenge that they may be facing at this time.
Thank you, Dr. Strang, a great message. Now we'll open up for any questions.
Just a reminder, each reporter will get one question and one follow-up. First question will go to Global's Alexa McLean.
Good afternoon, Premier Dr. Strang. I just wanted to take a look at grocery stores. We've heard of multiple reports of employees testing positive for COVID. Public health have consulted with the grocery stores, and apparently protocols have been followed, and there appears to be a low risk to customers. But this is something that keeps on happening. We've heard that the Braymore location at Dartmouth has also closed again today. So just looking at grocery stores, is there a cause for concern for people who are going into these stores? Are we at the point where how we grocery shop should change for the next few weeks?
So this was a topic of conversation actually with my team this morning. We are going to actually put it on the agenda for an urgent conversation with my chief MOH colleagues and public health across the country to understand how everybody across the country may be dealing with this issue. Having said that, we have to understand that many of the grocery stores are putting things in place. Just because their workers are maybe testing positive in certain circumstances, it doesn't mean that the grocery store was the place that they got that they actually got infected. Like we've talked before about people in long-term care facilities who work there. Grocery store people live in communities, and that's likely where their exposure is. Having said that, we need to make sure then that what is taking place in a grocery store that helps keep people apart from each other. And grocery stores are putting a lot of good things in place that minimize numbers, one-way directions of traffic, keeping people apart, and then I know stores are monitoring that. They put plexiglass up as a protection between the cashiers, and I know they're very concerned, and they're the same rules that we've asked for everybody in the workplace. Pay particular attention to make sure staff are aware that they should not be coming to work if they're sick in any way. So I think but there's a role for the public here as well, and we continue to hear stores still about lineup. So we were asking people to go to the grocery store no more than once a week. If possible, use online shopping and then picking up your groceries. Work in groups together in a community to have one person maybe shopping, picking up groceries for multiple households. There are ways that we as the public can also work to make sure our grocery stores, which are essential for all of us, remain as safe as we can. And a simple thing like even when you go grocery shopping, wash your hands carefully before you even go in there. And the grocery stores wipe down the handle on the grocery cart. So if we're all doing the things that we're asking you to do, and the grocery stores are doing lots of good things, that will help keep our grocery stores as safe as we can. But as I said, we're also having a national conversation. Are there more things we need to look at in a way that might make sure that we can maintain our grocery stores as a safe place for people to get the necessary food.
Alexa, do you have a follow-up?
Thank you, Tina. Just changing gears here. The projection models yesterday showed estimates of where hospitalizations may be at the peak of this first wave. Just wondering, when does public health expect our province to hit our peak, and what steps will follow that peak?
So as you say, based on the modeling, I mean, we didn't give time estimates on that, and modeling can do that. looking at where we're at and where in our timing compared to other provinces and how other provinces are moving through their wave, and even internationally, we can likely expect to see our wave coming, as I've said, towards the end of April, maybe into early May. Again, that's a somewhat of a best guess. We will see as time progresses, but that's likely where we're going to see it. And as you can see from the modeling, once we hit that peak, it doesn't drop off suddenly. There's a gradual reduction, which means that we're likely into June before we can even start to think about relaxing some of the restrictive measures we have in place. And even as I said yesterday, even when we do start to relax those measures, it's not like we flip a switch. We have to take them off carefully and gradually, monitoring the disease epidemiology as we do that, and being prepared to course correct if necessary.
Next question will go to CTV's Natasha Pace.
Thank you. Dr. Strang, I'm wondering whether or not there's an update on Northwood. I know yesterday there was 31 residents who were confirmed to have COVID-19. I'm wondering if you have an update today on any additional residents or staff at Northwood that have potentially tested positive.
So that's the number I have of 31 residents. That was a number very early this morning. There might be more coming in today, but any of those would be included in tomorrow's number. So I think it's important for folks to understand there was I think it was 13 new cases from Northwood today. So in our overall numbers of 32, almost half of those are being driven by the outbreak in Northwood. It's important to understand that context. As I said yesterday, we have two major issues which are driving disease in our case numbers in Nova Scotia. Is the situation in the eastern Dartmouth communities that we have good things in place now. I'm hearing good reports this morning about things are going very well there as we start to have the comprehensive approach to support those communities. And then we have long-term care facilities. The most troublesome one or worrisome one right now is Northwood, but we're working closely to support that community as well. Having said that, it is very concerning. I talked with the director there again this morning, Josie Ryan. The interesting thing is, and I've said this yesterday, I'll say it again, we're learning about this virus every day. Even though they have 31 residents who are have tested positive, that's part of their strategy. As soon as they have a single case on the floor, they test the whole floor. But what we're seeing is the vast majority of people who are even seniors, frail elderly in a long-term care facility who are testing positive, many are asymptomatic or have mild symptoms. There are 3 individuals who have more significant disease that are being treated within Northwood. So yes, the Northwood situation is concerning. We're doing what's necessary, what we can within that facility. But it's interesting to see how what's playing out is lots of people getting positive, but actually not getting significant disease, and that's encouraging. That may something to learn about how an outbreak of COVID-19 actually happens in a long-term care facility.
Natasha, do you have a follow-up?
I do. I'm wondering for Dr. Strang as well, whether or not there's an update on what could have caused the outbreak at the Magnolia Center in Enfield. I believe last time you spoke about it, you mentioned there was 2 events that happened there. I believe it was a funeral or a celebration of life, and also a training event. I'm wondering whether or not that, if you can update us on the situation there.
So we haven't been able to, with 100% certainty, say how did the virus get introduced in the facility. Clearly, what we're seeing is that how COVID-19 is getting into long-term care facilities is workers. Often when they're mildly symptomatic or even asymptomatic, we need workers to go to work to provide care to residents. We're having steps in place that we're now all workers are wearing masks, which will help decrease any transmission. But the reality is that workers come from communities, and if we have virus activity in communities, as much as we put steps in place, it's very difficult to stop any introduction into a long-term care facility. And we, on top of that, when we do recognize it, we have strong outbreak measures in place. So protecting our long-term care facilities is an important priority. We have greatly increased the coordination to support individual long-term care facilities if they do have an outbreak. We've given directives about, with clear expectations about how outbreaks are to be managed. But again, I'll come back to the comment that I made yesterday. One of the key ways we protect our vulnerable seniors in long-term care facilities is minimizing disease transmission in our communities, which minimizes the possibility of a healthcare worker in that community unknowingly being infected and then going to work. So we can do all we can in the healthcare system to protect our long-term care facilities. I come back to the point that we all need to work together to minimize the spread of COVID-19, including protecting some of our most vulnerable and long-term care facilities.
Next question will go to CBC's Shayna Luck.
Good afternoon. Dr. Strang, you've told us before about the study showing we need 80% compliance with public health measures in order to make a difference. What percentage compliance do you think we're at now? And how are you measuring compliance so you know we've got the appropriate restrictions in place?
So that study was a modeling study from Australia. There is no really great way to directly measure compliance. There are indirect ways that we can look at. The police enforcement is one, and we're still having a number of police are continuing to enforce and write tickets. There is some technology that's out there that we're getting some results on using tracking cell phone with geolocation and things like that. Blue Dot, and I think Google has a map. That information, which is being shared with each province and territory, I saw the results on Monday or Tuesday. It would show that we've reduced the amount of time we're away from our homes, but some provinces have done it even more. So there's still a fair bit of travel outside of our homes. What we can't tell with that data is how much of that is essential travel and how much is not. But certainly it's good news that there has been a fair degree of using that indirect data of reduction in travel away from home. All that to say, it's very difficult to have an accurate measure on compliance. I think the key point of why I use that study, and it drives home the message that we need to have everybody doing what they're asked to, what they're asked and told to, from the public health directives and the public health advice of staying home as much as possible, essential travel and shopping only essential groups of 5 or less. That it's critically important that we have all Nova Scotians doing that, and the stronger we're able to get to that, to 100% compliance, the less the impact of this virus, and the sooner we get out of this and life can start to return to normal.
Shayna, do you have a follow-up?
Yes, thank you, Dr. Strang. The other one that I have is for the Premier. Premier, the federal government is offering a wage top-up for certain essential workers if the province does the same. So I'm wondering, is the province ready to chip in a share of any top-up? And as well, if that is the case, then how should workers expect to receive this top-up, and who will get it?
The federal government announced that this morning. We're looking at the program, what they were describing, and we'll have more to say on it at a later date.
Next question is for Canadian Press's Kevin Bissett.
Yes, good afternoon. Question for the Premier. Premier, some experts and nursing home directors are saying that having 2 people to a room in Nova Scotia's nursing homes during the pandemic may contribute to the spread of the disease. Going forward, would your government consider ending that practice and ensuring 1 person per room?
Well, many of the new bills that are happening in our province are usually single rooms across Nova Scotia. There are some older facilities that's not the case. Each time that they go through a renovation, we would look at those. But right now, we're focused on working with the current infrastructure we have and those that are working day in and day out to protect our loved ones. And after we find our way through this pandemic, we'll look at certainly all the protocols associated with how we continue to ensure that we protect Nova Scotians.
Kevin, do you have a follow-up?
And just quickly, to follow up to the previous reporter's question about the top-up for the workers, how soon do you think you might have an answer on that?
I don't know exactly. Like I said, the federal government announced it today. We're looking at details of it. I had no prior knowledge that they were doing that today, so we'll have a look at it and then we'll communicate it as quickly as possible.
Next question will go to Olivier with Radio Canada.
Hi, my first question would be for Premier McNeil. Halifax says cities are bleeding cash and they will need provincial help to recover from this pandemic. Are there any options on the table at this time, or will the province be too strapped with its own finances to help?
No, we've been working with municipalities across the province. Minister Porter has a call with them later today. I've spoken a number of times with Mayor Savage and others across the province. We'll certainly be there to support them in the best way we can.
Olivier, do you have a follow-up?
Yeah, sure. Yesterday, Dr. Strang, you said that you're working to better represent, centralize the information available for cases in nursing homes. So what should we expect to be made public? Should we expect a list of all the facilities affected, the number of cases in each facility, whether it's employees or residents?
So we've now got a process in place that's starting today that's been summarized. Myself and other people in the Department of Health and Wellness will get that. We're looking at what information we then start to put as part of our daily media releases. I don't think we'd be necessarily identifying individual facilities, but we're looking at how we succinctly summarize all that information. So you can expect to start to see that as part of the daily press releases.
Next question will go to All Nova Scotia's Lindsay Armstrong.
Yes,
when it comes and we start to see our way through it, we're now looking at what are the potential options, not only of opening up our economy, but looking at how do we loosen the restrictions around mobility of citizens and access to parks and beaches. But let me be clear, we're not there. So before anyone communicates to Nova Scotians that we're not going to open up in 2 weeks or 3 weeks, we're not there. We need Nova Scotians to stay committed to following the public health orders. If we do that, then we'll be able to open up our economy and, quite frankly, our communities quicker.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. This is for the Premier. There are widespread concerns about a rise in domestic abuse amid the pandemic restrictions. HRM shelters are at maximum capacity for what they can do within public health protocols. Will the province consider providing funding to businesses such as hotels in order to provide more support to domestic violence victims?
Well, Minister Regan has been dealing with shelters across the province. We provided funding, one of the announcements we made early on, but we will continue to work with them and provide the supports necessary. It's tough enough that all of us are facing this pandemic and having the restrictions placed on us, but I can't even begin to imagine what it's like for some of our citizens, women in this province, who are afraid to be in their own homes with their children. And it is incumbent on us as a government and all of us to provide all of the safety we can to them, and we will do that.
John, do you have a follow-up?
Yes, I do. This would be for the Premier, either for the Premier or Dr. Strang. I received an email today from a woman whose son requires intense home care. She said the visits from Northwood have been down significantly because of the pandemic, and she's become exhausted. Can the province help somebody in her situation? I imagine she's not alone.
So I know at the continuing care table that there's a whole section on home care, and they have reduced things because some of the pressures from COVID to more essential services. But I would recommend that individual, that family, have a conversation with their home care provider, and it may be that as we've reduced essential services, not recognizing something that may have been thought as to be not essential may actually be essential for that family. So I would encourage that ongoing conversation at a very frontline level, so families can continue to get as best as the system can meet what is considered essential needs by the family for kind of home services or home support.
Next question will go to Chris Halef with News 95.7.
Thank you. This question is for the Premier. The Canadian Centre for Policy Alternatives released a national report yesterday regarding payday loans during the pandemic. Now, the report found these companies will see windfall profits at the expense of low and moderate income people if governments don't tighten regulations. I'm just wondering, where is the province at on this?
I think you asked me this question last week. I've actually asked the departments to look at what are the possibilities for us to tighten up the regulations around that. I don't know what the policy alternative said, but it's unconscionable in my view that someone would be making the kind of money that would come out of this based on the circumstances people are in. So I will get an update for you and let you know.
Chris, do you have a follow-up?
I do, and yeah, this is just a this is for Dr. Strang. This is a follow-up on my question about the church service yesterday. You said now that drive-in services will no longer be allowed. Could you just elaborate a little bit on what brought you to that decision, Dr. Strang?
So it's a recognition of first of all, there was not open in broadly of that. I gave a specific exception for a specific set of circumstances for one church that approached me with their particular requests around Easter Sunday. They haven't asked for ongoing pieces, but I think as we looked at the overall piece and some of the concerns, we need to make sure that people are as much as possible they're adhering to all the what we're asking them to do around reducing essential travel, staying home as close as possible. It's always trying to find the balance. Part of their request was based on Easter Sunday, which was very important to them, but also the challenges they have in a more rural part of the province, where not all of their congregation has access to internet. So virtual services are harder for them, but we're going to ask them to work and be even more creative, like many other churches are doing.
Next question will go to Nicole Sullivan with the Cape Breton Post.
Thank you so much, Chrissy. This is for Dr. Strang. We've been informed by multiple sources that there's a long-term care facility in the CBRM, which was announced to have had one confirmed case, which now has had 3 new cases confirmed on Friday. Now, these sources are telling us that all of these cases are from the same ward, that some of the staff from the ward have been tested, and some are self-isolating, and they're asking us if we can find out why the public isn't informed all the time. Could you explain for our readers what the protocols are when you announce the confirmed cases in long-term care facilities and when you list them as a place of potential contact?
So, we have talked about some individual facilities, especially the first one we've had. We will talk about facilities where we feel there's a need to do that. The reason I've been talking about Northwood is because the numbers are so significant that I think it's important that the public understands how that facility is playing in and can interpret our overall total number of cases. I'd use that as an example. So there needs to be a rationale of why we're going to actually name a facility. And it's the same of why we are limited in the amount of information we give around an individual case. There's always a need for respecting privacy of individuals. There's legislation around health information, but also we need to work with long-term care facilities. They're not unduly put undue pressure from communities just because they may have an outbreak going on. So it's always balancing how do we respect confidential and private information, and what's necessary for the public to know. And I would say, does it really make a difference if a community knows about a specific facility or not? We know we have COVID-19, that there can be COVID-19 in communities in any community across the province, and we're asking communities to do what they can do within their community and their home setting to minimize the spread. And so we always work with the balance of what we can and what's necessary to disclose.
Nicole, do you have a follow-up?
I do. Thank you so much. So to follow up with some other questions that my colleagues today on the call have asked and things that have been asked in the past, I'm just curious, as you yourself said today that we know that the workers are the ones bringing the virus into the long-term care facilities. Why are we not able to test all of the staff at the facility once one case is confirmed?
So we actually are. Once we get an outbreak situation, one of the things we do, we test residents and we test staff. Especially staff we start with staff who have been identified as close contacts with that case, and then we go further than that. But testing has its limitations because the workers go back and forth in the community, and I want to say that I want to be very clear that when I say that workers are unknowingly bringing it into community or from the community into facilities, I am in no means blaming workers or pointing the finger at them. It's just an unfortunate reality when we have a disease like this, that you can have people who are very mildly symptomatic or even asymptomatic. They can be infectious, and they are at work. And it's only when we follow up on a case that we're actually and look back in hindsight and say that's likely how it got into a facility. So this is not about blaming or judging or any individual or a group of workers. They are there doing very important and essential work and very caring work in challenging circumstances. So we do testing, but even if we had a long-term care facility and we tested everybody today, they were all negative, there's no guarantee that because they're moving back and forth with the community and there may be activity in the community, there's no guarantee that one of them may not be infected and still be asymptomatic and then come into the facility tomorrow. So testing plays a role, especially around close contacts of a case, but there's nobody who's doing for instance, testing on a daily basis. We are doing things like when we have an outbreak and we have workers who are known contacts that are still able to come to work because their initial test is negative. In those circumstances, we are doing daily temperature checks, regularly monitoring their health, ensuring that as soon as they become ill, they're off work right away. So we're putting those kind of steps in place in specific circumstances.
Next question will go to Bill Martin with Six Rivers News. Bill, are you there?
Thank you very much. Yes, thank you. For a question for Dr. Strang, you recently said you took a certain measure of comfort in what you called the plateauing of the daily numbers. And I look with interest at two other numbers. One is the hospitalization number, today 9 patients, and the other, of course, the recovery rate, today 137. Would you not find those numbers very reassuring?
So I do. The fact that we're not seeing, continual climbs in our hospitalization numbers, and many of those are people that have been in hospital for a length of time now. We're not getting ongoing new admissions, and the fact that we have recovery, we expect to see recovery. For most people with this disease, it's a mild to moderate disease. They don't need to be in hospital, and within about 10 to 14 days, they will recover. So yeah, we are. That doesn't surprise me, and I fully expect to see that happening. But the fact that we're seeing, not seeing significant impacts to date on our healthcare system, combined with some of the information we presented yesterday, are all good signs that what we're doing is having an impact. But again, I have to keep stressing that even though what we're doing is of good benefit, we need to stick with it. We have weeks of this to come yet.
Bill, do you have a follow-up?
No, that's fine. Thank you.
That's all the time that we have for questions today. Go ahead, Premier.
Thank you, Chrissy. I know there's lots of questions today about nursing homes, and I know there are lots of concerns surrounding the nursing homes and the health of our loved ones that live there. First of all, let me say I want to thank the operators and the staff who work in our nursing homes across the province and care for our loved ones. Oftentimes, they view them as their own family. And I know it's hard on our families on the outside. We've kept you away from your mother, your fathers, your grandmother, and your grandfathers. You've missed the face-to-face contact, the hugs and the kisses. You've missed birthdays, anniversaries, and many other occasions. And I really wish things were different. But we wouldn't be keeping you away from your family if it wasn't necessary. This virus is serious. COVID-19 has entered in a number of long-term care facilities. And when it hits our nursing home, it attacks the most vulnerable and spreads quickly. We need to stay strong in our effort to defeat the virus. That means wrapping our arms around the homes that are struggling. We are testing our residents to get ahead of the virus, checking their temperatures twice a day. We are isolating those who are sick and ensuring those who need to enter a hospital get there. We are providing masks to our frontline workers. We are checking their temperatures daily as well. Anyone who exhibits symptoms is out for 14 days and must self-isolate. We're doing all of this to ensure that your loved ones are safe. And don't forget our nursing home staff. You know them, express your appreciation to them. And you know they care deeply about your loved ones. They don't want to put anyone at risk, and they are taking all the precautions. We need to trust them, and I need to trust you that we can hang in a little longer. We have to continue to keep our nursing homes locked down. It is for the sake of our loved ones. But that doesn't mean that we can't communicate. Call your loved one, wave through the window, visit them virtually by using those iPads. And when we want the doors to open to our nursing homes, but we can't do it yet, help us help you to help your loved ones.